Emergency call. This is usually why we get called out. Tonight, what we are going to go over is just basically what colic is, how to prevent it, and certain signs to look for. How I did this is I kind of split it up in two, just based on personal preference of you guys. The first half is just going to be a basic overview, and then at the end of that, it should take about 30 minutes. I'll go ahead and stop and answer any questions if you guys have. And then for those of you who want to stay, I went over and detailed about 6 types of colic we particularly see. It's a little more educational, academic, so if that's going to go over your head and you want to take off, go ahead and take off before we get started on that. So colic, definitely the #1 killer in horses that we do see, but most cases of the colic that we do see are often mild once they start, and they can progress into more severe signs. A common misconception about colic is that it involves the digestive tract. Twisted gut, horse is constipated, can't poop, doesn't want to eat. But other things that can cause it are any kind of GI abnormality or abdominal organ. So that includes any pain. Sorry, technical difficulty. So going back to any organ that can cause it, I've seen problems with liver problems in horses that have caused signs of colic, kidney problems, even pneumonia or respiratory problems can cause signs of colic. So just a little FYI for everybody. Recognizing colic. Colic, there's a lot of signs from very mild to very severe. And just going over some of these signs with you really helps us when you guys give us a call and say, my horse is colicky. Well, to us, yeah, your horse is colicky. What exactly does that mean? Does it mean he's just not eating and uncomfortable, or does it mean he's rolling, sweating on the ground? So a few of them, there's a couple lists here, are leaving food, so obvious absence of appetite. That's one of the first things that we'll see. Repeatedly lying down, so getting up and down, looking for a spot to lay, as opposed to their normal behavior, laying down for about an hour out of the day. Turning the head towards the flank, pawing, kicking or biting at the belly, repeated rolling, sitting in a dog-like position, so their haunches on the ground and their feet are planted on the ground, and stretching out or posturing to urinate. This is another common misconception that we get, is my horse can't pee, it must have a urinary tract infection or a stone. Could very possibly be, but not too terribly common in horses. Often what they're doing, and this includes dogs as well, is when they stretch out, they're trying to relieve the discomfort in their abdomen where they're having colic issues. So a few more clinical signs. Holding head in an unusual position, so kind of down and mopey, or when they're laying down too, you can see their head arch sometimes in discomfort. Lack of bowel movements, not making enough manure like they normally should. Normal production for horses should be about 8 to 10 piles in a day. Reduced or absent digestive sounds, and where we listen to for those would be right here on the sides, right by their flanks on both sides. And we usually listen to both the top, so closer to where your saddle almost ends, and then closer to the bottom as well. And then inappropriate sweating, so they just start breaking out into a sweat, laying down very uncomfortable. Rapid breathing or flared nostrils, elevated pulse rate. Normal pulse rate for a horse is about 28 to 40. When it starts to get over 40, especially in the 50s or higher, sorry, I keep hitting that button, then we start to get concerned, because that's usually an indicator of pain. Depression, just not acting how they usually should. And lip curling, also known as the Fleming response, which is when their upper lip curls in the air. Sometimes your stallions will do that when it's during breeding season, but if your horse is curling its lip and they're not in breeding season, it can be a sign of discomfort. So going along with the lip curling too, another sign that's not on this list here, a horse on Saturday that I saw was doing this, is what we call dunking. So they actually stick their muzzle past their nostrils in a bucket of water, and that can also be a severe sign of colic if your horse isn't usually one who likes to play in water. So recognizing colic. You can definitely take care of these on your own to the seasoned horse owner, but most of the time, all the time actually, we'd love to hear from you guys just so that we know what's going on and to see if it's something we can help you out with over the phone or if we need to actually see your horse. Few things that we will ask you to do is to remove all food from your horse for the time being. Definitely leave some water so they can still hydrate themselves. And keep the horse in an area where it can be watched, preferably in a larger area if your horse is laying down a lot and getting cast, just so it's in a bigger area to manipulate them and get them out of trouble. Allow them to rest or walk the horse, around if it's continuing rolling or in danger to hurting itself. This is another misconception. Number 3 is if your horse is colicky, keep them walking for hours on end. I had one lady call me and says, yeah, I've been walking my horse for 6 hours and it's still not better. How I explain it to people is if I have a bellyache and you ask me to go run a marathon, I'm going to tell you where to go. I ain't going to do it. So walking your horse for about a half hour to see if that helps definitely helps. But why we want you to walk them and continuously, regardless of the time, is if they are laying down trying to hurt themselves until we can get there, because that just prevents them from hurting themselves. If you can't do it safely, though, getting your horse up and just let them lay down. And always to continue to observe as well. Important information for us that we like to hear are the specific signs of colic. Going back to the few slides back, that lists some details. If you could tell us specifically, they're pawing, they're breaking down to a sweat and rolling down a lot, then we know that we have a pretty severe colic. If you tell us that they're just kind of uncomfortable, looking at their sides, not quite themselves, over the phone it sounds like it's not too bad of a colic. If you can take the pulse or the heart rate, that helps as well. Respiratory rate, rectal temperature, color of gums, and the moistness of gums. Reason that temperature will help us a lot is because your horses that have a virus, like your flu, they'll sometimes act colicky, they're lethargic, depressed, and don't want to eat. So if we take a temperature and then we say, aha, it might actually be the flu. And with gums, you can see here on the top, this is just a little bit darker than normal, a little more pinkish purple. And then down here we have what's called brick red gums. That's usually due to toxemia here on the bottom. And we'll get into that in more detail why that happens. Capillary refill time, which means when we push on the gums here and we release, we count to see how long it takes for the gums to return from white to pink. Normal is about 1 to 2 seconds. Listen to digestive sounds if you can as well. Note how many piles of manure your horse has passed since the last time you cleaned the pen, if you can count them. Any recent changes in their routine, diet, exercise, even if you've gotten a new shipment of hay from the same supplier you've gotten for the last 13 years, it's still not the same. It could be different. It's helpful for us to know that. And then also medical history. Have they been recently dewormed or vaccinated? That helps too. Things to avoid. So we would prefer that you don't give them any medication until you give us a call. 1, so we know what's going on with the horse first. 2, if any medication does need to be given before we see, because by the time we get out there, a lot of times the medication can mask the clinical signs of colic. Makes our job a little more difficult to evaluate what's going on. So if you can hold off on meds, that would be great until you talk to us. Try passing any kind of tube in the horse's stomach, just because veterinarians are specially trained to know where we are in the esophagus or the food pipe versus the trachea or the windpipe. If you stick a tube down into the trachea and you get fluids down in there, you can cause a pretty severe pneumonia and something worse than probably what you have already. Giving the horse any substance by mouth, particularly liquids. This is like especially trying to force feed them some mineral oil through a syringe or a water hose up the mouth. Again, we're talking about aspiration pneumonia. And inserting anything into the horse's rectum. Please don't rectal your own horse. Please don't stick a water hose up your horse's rectum thinking that you're going to give them an enema, because you could do some pretty severe damage to their rectum. And giving intravenous injections. Again, just try and hold off on medication until you can call your vet. More information, going back to history. Has your horse recently been dewormed, vaccinated, got any other medications or procedures? Just going over your observations as well when we get out there. And What else we would do once we get out there to see your horse and talk to you? So we start with just a basic physical exam, taking their heart rate, respiratory rate, listening to gut sounds, looking at their gums, and taking their temp. That gives us a good idea of how severe the colic is, where we need to go as far as treatment, and whether or not it's something that we can just treat at your farm or boarding facility, or if it's something that needs to be brought into the hospital. Rectal palpation, that helps us a lot too. We're not just going in to clean out the poop and help the horse feel better like some people have asked me. We actually can feel the insides to see if something is in the wrong place, if it's gas distended, if there's an impaction somewhere. So just gives us more information on why your horse is colicky. And we will also pass a stomach tube, also known as a nasogastric tube, just doctor term for it, to not just put mineral oil and water into their tummy, but it's also a diagnostic tool as well. What we look for is reflex, also known as vomit, because horses cannot vomit on their own unless if they're extremely ill. The 3 years I've been doing this, I think I've seen a horse do it 4 times, spontaneous reflex out of their nostril. That's usually a pretty severe sign of colic as well, and definitely need to get us out. So as long as they don't have a whole lot of reflux or vomit pooling in their stomach, to us that means that stuff is being able to move from behind, and we can give them more liquids to help them out. Further veterinary evaluation, sometimes we do this out in the field. It's called a belly tap. You'll hear us refer to it as a peritoneal tap as well. And what we do is we collect abdominal fluid. And what abdominal fluid is here's your horse's digestive tract from the left and from the right. We don't sample fluid from the colon or the intestines, but the fluid that is floating in the belly all around, bathing your organs. And based on that fluid, we can evaluate the color and the protein content and something else called lactate, again, to help us determine how severe the colic is. Again, sometimes we can do this in the field, but if I'm by myself, this is usually something I prefer to do in the hospital. Just like with your joint injections, we're going into a sterile environment, and we want to try to keep it pretty sterile. Blood tests. The 2 main ones that we usually run here is what we call packed cell total protein and a lactate. Your packed cell and total protein measures how many red blood cells are floating in the blood, and your protein measures how much protein is floating in the blood. Based on those numbers and how high they are, we can give an estimated percentage of dehydration. We can be pretty accurate within 1% based on the levels. And then another one that we measure is lactate. Everybody have heard of lactic acid, crampy muscles. Your digestive tract is made out of muscles as well, in part, because how else is it going to move without muscle? So when your digestive tract's a little irritated as well, it's going to make some lactate, and that gets picked up in your blood. And it also can be picked up in your peritoneal tap as well, is often higher in your peritoneal tap. And based on those numbers, we can give a better idea of the severity of the colic. And then if they are here at the hospital, we watch to see how they respond to treatment. If they're doing pretty well, we haven't had to be giving them Banamine more than every 24 hours or so, or we haven't had to give them any Banamine, they're usually good to go. But if a horse is getting progressively painful, those horses sometimes need more help, whether it be IV fluids or colic surgery. But again, we go back to these tests here, and then what we had here on our previous slide, passing the stomach tube and rectal palpation to give us a better idea of where we need to go. Ultrasound is another procedure that we can do, usually done here in the hospital as well on emergency. And what we can do is actually ultrasound from the outside of the belly. And what we're looking for is where the organs are in relation to the body. We also look for small intestine as well, small intestinal lesions, because your small intestine, if this is the head here of the horse, this is the rectum, your small intestine lays right here. That's very hard sometimes to feel on rectal palpation, but with an ultrasound we can see that pretty readily and say, oh, we have a small intestinal problem. So classifying colic, these are 3 different general types of colic. Intestinal dysfunctions, This is definitely the most common category of the ones that we see. It can include gas spasms, gas colic, impactions, or decreased motility. Impactions, how I explain it to clients is your horse is constipated, whether it be from some dry manure, even some sand, hair can cause it. It's a blockage in the digestive tract somewhere. And these ones often respond well to medical treatment, meaning just passing a stomach tube, giving them some Banamine and seeing how they do. But not to say that these simple colics can often progress into more severe colics, and that is often how you get a more severe colic. Intestinal accidents. This refers more to when you hear of a horse of a twisted gut. So anytime that you have this here demonstrates a twisted gut. You see the blue here, that demonstrates more normal colon. Not to say it's blue normally, but just to illustrate it. And then here you see some black. This is the part of the colon that's gotten twisted. In addition to twist, it encompasses entrapment, so pieces of intestine or colon that are in spots where it shouldn't be, emboli or clots to the blood vessels of the digestive tract. That usually happens when we get the twist. And again, how I explain this to clients as well is it's kind of like a python being wrapped around somebody's neck. It keeps getting twisted tighter and tighter, and you don't have any blood supply anymore. And that's what happens to your digestive tract. Again, listing here, it may restrict blood flow to certain parts of the intestine. And this category almost requires surgery to help it out, because it's not very often that they can fix that themselves. That's something we need to open them and reach in and get it for them. Inflammation or ulceration. This can fall under what we call a medical colic. What happens is, for example, when we think of ulcers, we almost always think that ulcers happen in the stomach in horses, but another place that they can happen too is what's called the right dorsal colon, or in the large colon of the horse. We can't see that with a scope like what we can with your stomach, but it can still affect your colon in your horse. Usually caused by stress, medication, infection, or parasites. Another thing that can cause inflammation or ulceration would be colitis or an infectious diarrhea. Treatment. We definitely start with pain relievers, analgesics, or sedatives. So if you hear the words Banamine, xylazine, dormocidine, torbugesic, those are usually the 4 medications that we use to help sedate a horse, take away the pain, and see how they respond to it. Fluid therapy, either through a stomach tube or through IV fluids here. Laxatives, including mineral oil. Tranquilizers, acepromazine. I don't use a whole lot of that for colic. Do you, Dr. Lamb? No? Okay. Yeah. So mostly ditomidine, which is the medical term for dormocidine, and surgery if they need it, again, depending on how they respond to treatment. How to prevent colic. This is probably the $1 million question. If I had a crystal ball, I would be able to tell you, but here are some pointers. So the main thing is establish a set routine. Easier said than done, understand, especially out here in the desert Southwest. So just be consistent with exercise, water, feed, care. That's the best thing that you can do, and especially preventative care. So vaccines and getting your horse's teeth floated. You'd be surprised how many horses can colic because of bad teeth, because they can't chew their food very well. Refuge is extremely important as well. Definitely feeding them some fiber to help regulate their digestive tract. Just make sure they're more regular, and try to keep grains on a lower end as far as how much you feed, because they can cause some acid, some digestive upset. Limited amount of the grain-based feeds, covered that. Divide the daily concentration ration. So if you do feed grain, instead of feeding it one time during the day, try and spread it out to twice a day if you can, just so they're not getting a whole bunch of sweet feed at one time. And establish a parasite control program. In some areas of the country, we don't see that much here just because parasites aren't too terribly common. Sometimes impactions can be caused by worms as well. Provide exercise or daily turnout, going back to establish a set routine, and proper dental care. If your horse can't chew their food very well, sometimes they're swallowing a fiber size that's just way too big for their digestive tract to handle, and it can turn into an impaction. So just something to think about. We're not just doing dental care to make their mouth feel better, but to also help prevent colic. Any changes to the diet should be gradual. I usually recommend if you're changing your hay to slowly do it over a 2-week period just to get your horse accustomed to it. Provide clean, fresh water. I know it's a pain in the butt cleaning your water buckets every day, but if you can, clean them every day. I personally prefer to give water from buckets instead of an automatic waterer, so I can monitor how much water my horse drinks. Horses on average here during the cooler months, probably about 10 to 15 gallons a day. During the summer, you're probably pushing about 20 to 25 gallons of water a day that they need to drink.
I have a question.
Yes, ma'am.
You know, the buckets always seem to get the algae on it.
Mm-hmm.
You scrub it.
Mm-hmm.
But is there any other thing you can use? Like, is Clorox bad? You go and you bleach it to get it. I mean, is that bad to do that?
That's what I personally use to clean them up, but you just got to make sure you rinse that bucket out really good once you're done.
Okay.
And if you're dumping your buckets daily and cleaning them daily, you won't get that algae problem.
Okay.
Put this back on. There we go. Then check hay, bedding, pasture, environment for potentially toxic substances. There are some poisonous weeds that can affect the digestive tract and cause, going back to like the ulceration, irritation of the colon, can cause signs of colic. Not too common down here, but I have seen it in a couple horses, mainly with liver problems. Avoid feeding on gravel or sand for fear of consuming with ration. I know everybody struggles with this. I struggle with this myself too with my horse, but this is one of the big things here in Las Vegas to really help prevent colic, because that's one of the biggest proponents of sand colic. Reduce stress, changes in environment. If your horse is more stressful when they haul or something like that, try to make it as calm as possible for them getting one place to another. Pay special attention to them when transporting. Observing foaling mares. Any of you that will have foals, one of the things that mares are predisposed to up to 3 months after they have a foal is what's called torsion or twisted gut. So if you ever see a mare that just foaled that's colicky, give us a call immediately. Don't wait on that one. Pay particular attention to horses with previous bouts of colic. Sometimes horses that have colicked once will colic again. Not all of them, but some of them I do see on a more regular basis. And maintain accurate records. So going back again to when was the last time your horse was vaccinated, dewormed, floated, items such as that. So in summary, key to minimizing good colic is good management, just good animal husbandry. Keep your routines consistent. Keep your feed consistent if you can, and treat every incident of colic as a potential problem. Because like I said, often your mild colics are the ones that, your severe colics often start out as mild colics. So as soon as you see your horse colic, even if it's just mild, we would prefer if you guys give us a call instead of hee-hawing about it, debating whether or not to give us a call. We're always here just to talk over the phone if you just want a consultation, so don't hesitate. So that's where we'll stop with this first half here. Any questions? Because I talk really fast, I know, and it's an information dump, so. Yeah. Yes? No, Linda, no.
I've heard both that brand mashes are good for changes of weather or to avoid colic either on a weekly basis or something, and then I've also heard other places saying don't do it, so I would like to know what.
No, that's a really good question, because as a kid, that's what I did too during the winter time, is I gave my horse a bran mash, because I actually live somewhere where it actually snowed. So, so I did give her a bran mash just to make sure that it would keep her more regular. Studies have shown that your bran mash really doesn't have a whole lot of fiber in it to actually stimulate the digestive tract to keep them more regular, but it is a great substance to use if you're trying to get a medication into them, especially mineral oil. So if you are feeding a bran mash, I I think feeding like a pound once a week should be fine. Second thing we get concerned about with your bran mash is the magnesium content, and we'll get into that too. It can be high in magnesium, which can cause some other issues in horses.
Okay, should it be, so it works by the fiber, just like giving them food?
No,
Okay.
that's why we originally were feeding it, because that's what we thought it did, but it really doesn't.
Does it work by
You look
stimulating?
at the diet we're feeding horses, they're on the highest fiber you can get in from feeding hay and whatnot. I mean,
Does
I
it
think
stimulate?
Brand's gonna do something special, and they have to advocate not to.
Yeah.
Unless, like Dr. Boeche said, it's a great vehicle to put mineral oil in. It's hard to get very much mineral oil down, and you like to get, like when we oil them, we're giving them 3 to 4 quarts right off the top. And you can get about a pint of mineral oil into a big brand. It's not real running. And it's good in the summertime, older horses especially with hard dry manure. It's good to give them a bran mash with the mineral oil. But the bran itself is a poor laxative.
Yeah. So it really doesn't, long and the short, bran mash, when we're talking about wheat bran, we're not talking about rice bran, they're completely different. Really isn't good as a laxative, but if you want to get some mineral oil into your horse, works great.
I thought it maybe stimulated thirst to get them to drink more. That's not.
That I haven't heard.
Okay.
Yeah. Yes, ma'am.
So, going back to these horses moving in the dirt
Mhm.
constantly, how effective is the psyllium?
We'll get to that.
Okay.
Okay. Yes, sir.
We feed primarily pellets. Is there any evidence to suggest that there might not be enough roughage as opposed to feeding them primarily hay?
Pellets or cubes?
Pellets.
Pellets. Is it alfalfa or Timothy?
It's a mixture.
Okay.
They get grass during the day.
Okay. It's still roughage because it's still made out of hay, so it's still going to stimulate the bacteria to go through the digestive tract. The main thing that I would be concerned about with that, not related to colic, would maybe be choke if they swallow the pellets too quick and can't get them in small enough sizes down their
Yeah,
throat.
they chew them pretty well. So that's
Okay. Yeah.
It's like bunny rabbit. It's really small.
Yeah, and that especially too, because a lot of times when I see choke, not to get off track, it's usually due to a pelleted feed that like your equine senior size or something like that. Yeah.
So you're saying cubes are better?
No, that-
Not necessarily. Me personally, I prefer just straight hay. Again, it's going to be one of those things where it comes down to personal preference. So, and I'm sure Dr. Lamb might have a different opinion as
The
well.
problem with cubes,
Yeah.
it's not a real problem, basically. Anytime you take a feed process, like they do cubes, where you're mashing, grinding, compressing, you oxidize a lot of the vitamin A nutrition. When you look at a bag of pellets, most of the pellets you can buy and read the label on it, they take you several minutes because they have all that stuff back to the pellet as they're making. Whereas cubes, they don't. They just take the actual feed, crush it, beat it all up, put it into the cube, and it loses a lot of nutrition. Which, if they're making it out of alfalfa, it's way more than most horses usually need anyway, so it's not a big problem unless you have hard-keeping horses, young growing horses, stuff like that. But I don't think cubes are nearly as good pellets, good quality pellets.
So a pelleted alfalfa would be a better choice than, let's say, moving cubes.
Then a cube alfalfa, yes. Cubes like some animal, you do that too.
Right,
Any
because
kind.
a cube you're fine.
But most like you're feeding alfalfa cubes, those things are start out at 17 to 20% protein, which an adult horse, your horse needs 11%. So if you made it into cubes and you lost 5%, you're still ahead of the game. So in those adult horses, it's not a big problem.
Yes, ma'am.
Is there anything while the horse is colicking to get their hydration a little bit more? Any of the additives to water to maybe get them to drink a little more?
Besides offering them a mineral block or a salt block in their pen, what I recommend is just using some good old table salt, sprinkling a tablespoon, even if it's just on top of the hay, to stimulate them, just to get.
I mean, like while they're colicking or during the colic?
Not necessarily, because this is just my train of thought. that's probably going to be the least amount of their worries, trying to get something down them to drink at that point. So I really don't think electrolytes at that point would help. I think before the incidence of colic would definitely help. Yeah.
Because I know you don't want them to get dehydrated.
Right.
Because of, okay.
Right, absolutely. But after we see them and treat them, if you want to give them electrolytes, even offering them Gatorade after we
Well,
see them.
unfortunately, we live, kind of far, and sometimes we
Right.
don't get service.
Right.
As you guys may get it here, so
Mhm.
sometimes we're on our own for
Okay.
a number of hours, so we'd
Okay.
like to know.
Yeah. If you want to see me afterwards, I can give you specific electrolyte recipe that includes table salt, light salt, and baking soda that you can make at home. Okay.
Yes.
And I'll have to look that up for you, but that's what we used a lot where I went to school at Colorado State for electrolytes. Okay. Mhm. Yes, ma'am.
I have a question, and kind of goes back to nutrition again.
Sure.
We're starting to see a lot of advertisements for chafe hay, hay lids,
Mhm.
it's the hay that they're now compressing cubes.
Mhm.
I was around in New England 15, 17 years ago, and they had a lot of trouble with it when they first introduced it. What's your experience been with it now?
I know there's one barn in particular that will use the hydration hay while they're shipping the horses just so they can get them to drink. Maybe one of the problems they were having is it fermenting. And when it ferments, sometimes they can get some toxins. So that's probably the problem that they were having. So that's been my experience with it. Does that answer your question?
So you're still seeing that
Some people,
fermentation problem with it?
I haven't seen it recently, but I have heard of reports of it happening. Okay.
Is there a place in the general diet or good maintenance program for either apple cider vinegar and or doing mineral oil on a regular basis?
We'll get to that. Yes, ma'am.
Get to mine too.
I'm fairly new to proper horse care, so
Okay.
what would be the normal heart rate or the oxygen rate to measure the horse?
Okay, normal heart rate for a horse is 28 to 40 beats per minute. You can get a stethoscope at CVS or Walgreens to count that. And when you're counting a horse heart rate, make sure you listen for two sounds, lub-dub, lub-dub. And don't count those as 2 beats. Each lub-dub equals 1 beat.
And people do have a client calls their heart rate, horse's heart rate was 84.
Oh, no.
Yeah. Right, yeah. Normal respiration rate's probably about 10 to 16, depending on the time of year. If it's during the summer, closer to 16 to 20. And normal body temperature for a horse is 99.0 to 101.5. Correct. And you can get a digital thermometer again at your local drugstore. Good questions.
Don't put it in their mouth either.
Yeah. Yes.
You have to do that.
Yes, ma'am.
I actually have 2 questions.
Okay.
First question, do you find like horses that crib are more apt to colic? Okay. Second question is, when you have like different horses, when they pass some manure, they pass it in different forms.
Right.
And so let's say one horse passes it in like little tiny round apples that are all separated, and then you have another horse just 2 stalls down that, plopping it in a big pile. With that horse that's, putting it out in like a little apples, would you say that they need a different type of diet or a different type of, food to make? I mean, is there a certain kind of manure when you're saying you need to pick up like anywhere from 6 to 8 a day? Is there a particular type of texture it needs to be?
Form balls with moisture. So when you pick them up and fill them in your hand, they should fall apart in your hands pretty easy, but it shouldn't be really soft and soupy. Sometimes
like cow patties are bad.
cow patties usually are that's pretty soft. That could mean if you're anywhere from allergy to hay, which you would know about.
Or the cribber.
Yeah, cribber or sand colic can mimic that as well. Colitis or infectious diarrhea can do that as well.
Okay.
If you see that, I would recommend monitoring your horse. Just, are they happy or do they act sick? Number 1. Number 2.
Probiotics is a good thing.
Yeah.
And you can you OD on probiotics or like if you keep them Like,
Not
Not
necessarily.
like a scoop a day, like let's say it's on a maintenance type of
Right.
thing, give them a scoop a day.
As long as, depending on the mineral content and electrolyte content, if it has that in there in addition, you can. But if it's just a straight probiotic, don't,
Every
because
day
that's
just-
like you eating 5 cups of Yoplait a day, I guess.
Okay,
Yeah.
thank you.
I think there was a question over here. Yeah.
I've asked the temperature. Outside of the normal range,
Uh-huh.
what would you consider more of a dangerous fever? So with humans, you want to keep it at 102 to kill off the virus, but anywhere past that, maybe go to 104 and you want to go to the emergency room. What would that range be for horses?
To expand on that too, let's start on the low end. If the temperature is lower than 99.0, like if it's around 97.5 up to that, I really don't get too terribly concerned, especially if it's cooler or if it's first thing in the morning, because horses acclimate to weather just like how, for example, people in Alaska, they would be in shorts and tank tops right now with the breeze outside. At least for me last night, I had a sweater on. So yeah. As far as fever, it again goes time of day. It's going to be warmer in the afternoon because that's when the body has had a chance to warm up. Time of year as well. So this time of year, I would say if it's in the low 101.0 range, you probably have a small fever coming on. Average fevers that we see is probably like around 102 to 103.5. Dangerous for a horse, and correct me if I'm wrong, I would probably put it at 104 or warmer. I have the warmest I've seen is 106.7, and that horse had a pretty bad viral infection, but came out of it. Good questions. Yes, ma'am. Yeah, go ahead.
We were talking about fiber earlier,
Uh-huh.
the bran mash.
Mhm.
What about beet pulp? Is that something good to kind of keep them on?
Beet pulp, people usually feed that to put weight on horses, and it is a fiber, and usually where it makes its nutrients is in the large colon where the bacteria have a chance to ferment it. As a veterinarian, I cringe when people tell me that they feed beet pulp because it can cause colic and it can cause chokes as well if it's not fed appropriately. Yeah, so making sure it's soaked when you do feed it. And if you do have it on the property, I recommend making sure it's locked. So in case if you have a horse that gets loose, they can't open up the feed bin and get into it. Because I had a choke like that happen. I think the horse ate 25 pounds. Yeah, yeah, that was fun. Yes, ma'am.
On your electrolytes, do you prefer the ones with the table salt, or do you like the ones you get from the feed stores? On your electrolytes,
Uh-huh.
do you prefer just the table salt, or do you prefer the ones that come from the feed stores?
I get the feed store one with the mineral just so my horse isn't getting just salt, some minerals on top of it too.
Because
Yeah.
I've got a beef keeper right now that
Uh-huh.
I have a hard time keeping her weight on her.
Yeah.
And she won't touch her mineral ball.
Yeah.
It's just
So-
things that I like to
Yeah, because really the salt is just to stimulate thirst. So, yeah, if you want to try the table salt, if you're concerned about her drinking, you can
Well, I
give
got
that a
some
shot.
From the feed store that was the
Okay.
minerals that I can make sure that she's eating it.
Okay.
Versus just the table salt, because I thought it was a little salt's too.
Okay. One more question, we're going to go on.
Someone told me that putting Kool-Aid in the water bucket stimulated the horse to drink because they like the taste of it, yes. And it did work on my horse a couple of months ago, so it might be something to try.
Yeah.
I don't know, do you guys
Depends on the horse.
recommend it or no?
Depends on the horse. Sometimes,
Lemonade
They
works.
advocate you put a lot of beer in the water.
yeah. Beer, apple juice, molasses. Yeah. Yeah. All right, so now we're going to go over specific types of colic. This is probably going to take us like another half hour or so. So if you guys need to go, it's 6:45 right now. Feel free to go, but if you want to stay. This is just something I wanted to throw in to kind of help educate you guys, because sometimes when I try to explain to clients what's going on with their horse, I get that blank look on their face. So I'm trying to see if any of this makes more sense to you when we tell you your horse has a strangulating lipoma or it has an enterolith, just to give you a better idea of what's going on. The 6 things that we're going to talk about, starting with the first one, is impactions. Then we're going to go to sand, enteroliths, right dorsal displacement of large colon, strangulating lipoma, and then the dreaded large colon torsion or volvulus. So before we go, we're going to do a brief anatomy lesson because I think this is probably where a lot of things kind of go over the head. It did to me too when I was learning anatomy first year. So this is the right side of the horse, head, tail. Your esophagus or your food pipe goes all from the mouth all the way down here to your stomach. And then the food leaves the stomach, it goes into your small intestine, okay? And then it travels through here, goes to your cecum, which is attached here to your large colon. And then you have your small colon before everything exits out. The left side of the horse kind of throws you for a curveball because what happened? We don't have any cecum over here anymore. Your cecum normally lives on the right side of your horse. So that's one of the things that we use to help us determine if things are in place. So left side of the horse, again, you have your esophagus, your stomach, small intestine, and then your large colon. You can see how much of that encompasses the abdomen of your horse. Then you have your small colon and your rectum, okay? So esophagus, stomach, small intestine, large colon, small colon.
Can I ask a question about this?
Yep.
I never thought about that, but I always listen with my ear against the stomach on both sides.
Mhm.
Because of that, is one side going to be louder than the other?
Not necessarily. One thing that I do hear a lot though that might be different is on the what we call the right dorsal quadrant here. I might hear a little bit more gas because sometimes this part of the digestive tract in their large colon does get filled up with gas with impactions. Okay, yep. If you have any questions, go ahead and stop me. Don't worry about it, okay? So, impactions. It's usually due to compressed fecal material. Again, basically your horse is constipated. Other things that can cause it are sand, hair, especially in minis or ponies that like to groom each other, and worms too. But again, we really don't see that a lot down here in the Southwest just because we don't see a lot of worms. It's often in the large colon when I see it. It can happen in the small intestine or the small colon as well. A type of feed that likes to cause small intestinal impactions, especially if they're not used to it, is Bermuda hay. It can be due to decreased water intake, change in feed, bad teeth, so really can't chew their fiber very well, or recently dewormed, going back to the worm blockage. Okay. Treating an impaction, these we can often treat out in the field, so meaning at your place. Just going back to our physical exam that we did, rectal exam, passing a stomach tube, giving them some Banamine and some sedation as well. And while we're there, in writing up your invoice and instructions, we are also watching your horse to see how they respond to the medication. One of those sedatives we usually give is xylazine, and also known as Rompum. It lasts about 30 minutes, so that's a diagnostic tool for us as well. If your horse isn't comfortable for 30 minutes with that medication, usually means something more serious is going on. More severe impactions may need to be hospitalized. What we do here, there at the hospitals, check the hydration status. Going back to our Paxil and total protein, that's what we start with. Administer IV fluids as this horse is getting here. And people get surprised when I tell them that within the first 24 hours they can easily rack up $1,200 in IV fluid therapy for their horse, because horses on average need a half gallon each hour to maintain proper hydration. So these bags here are 5-liter bags, so your horse almost goes through a half of that bag every hour when they're here at the hospital. And when they're dehydrated, there was one horse I saw that was 10% dehydrated, so that meant it lost 10% of its body weight in water. So on your average 1,000-pound horse, that's about 100 pounds of water. So we got to catch up a lot with IV fluids. So just a little plug. It can progress to a more severe colic, going back to treating your mild colics when we first see them so they don't progress into a worse colic. We'll get into that, why this can happen. Actually, might as well do that. So it can progress to a more severe colic because going back to here, we have compressed feed material. So if your food is stuck in your large colon here, right in here, so say for example here at your pelvic flexure, what can happen is the gas can continue to build. Your gas continues to build because the bacteria that lives in everybody's digestive tract makes gas as a byproduct. But if they're blocked here, the gas accumulates in this colon and causes it to blow up like a balloon. And that's usually what predisposes horses to get twists and colic. Sand. So this is going to answer your question. Ingesting sand usually from the environment. Grazing in a paddock after they're done eating. Looking for food that they've dropped within their stall. It can sometimes be baled up in hay or cubes. I don't know if you've seen it in your feeder after you throw your flake down in there and you look in your bucket and you say, how did I get a pound of sand in there? It can get baled up or blown up in your hay. It can cause impactions or an irritation to the gut, going back to a few slides before talking about ulcerated colons. It can cause diarrhea because if you can think of sand, what sandpaper does to wood, if you have it in your digestive tract, it's going to do the same thing. Rub the inside of it and then cause diarrhea and possibly a low-grade fever, so around 101 to 102.5.
So is that when you recommend the sand wax every first week of every month?
Yep. Yep.
Like, really recommend it?
Yeah.
When we're buying that, you see there's all sorts of different brands of this. There's sand clear.
Right.
Is there seems
And to me, psyllium is psyllium fiber.
Psyllium
So
is psyllium.
I would read the label to see what the percentage is. As far as what percent, I would have to get back to you on that.
Okay.
As far as what's a good percent. Okay.
It should be high, 99, 97%.
Okay. Okay. In severe cases, can often be hospitalized for up to 2 weeks. I've had a few patients where it's been 10 to 14 days where they're on IV fluids and medical management, and it can cost as much as a colic surgery to have those guys treated. How to prevent sand colic. I want you to ingrain this picture in your head. We really don't like to do that, but unfortunately, that's how my horse gets fed too. Getting fed on the sand. So ways that we can help prevent it out here. You can invest in slow feeders. You Google a slow feeder, you'll get so many pictures for do-it-yourself ones that you can make. Hay nets or nibble nets that you can use while you're traveling, but you can also use it to feed your horse at home. Large tubs with boulders, putting rocks in there, it will help weigh down the bin so they can't knock their hay out. It'll also slow down them from eating because they have to eat around some boulders in there. And again, make them big enough because there are some horses that like to eat rocks. Yeah. Rubber mats. What's important with your rubber mat is putting it under your feed area. Make sure it's big enough. I usually recommend like a 10 square foot area because your horse is going to toss your hay around quite a bit. Another thing you're going to need to do is sweep it on a daily basis because we don't live in a very not windy area. No wind's going to be blowing up dirt on there as well. Grazing muzzles, that can help as well when you're turning out your horse just to limit their sand intake so they're not busy looking for sand. Limit access to sandy turnouts. There's some people that they turn out their horse, watch their horse, as soon as their nose goes straight to the ground, unfortunately they go back in the stall. Use sand-free bedding, composting manure, woody pellets, wood-based material can help as you're mixing it in with your sand. It will take some time, but it helps. And psyllium fiber. Psyllium, what it is, it's fiber bulk, not to prevent sand colic, but to help clear the sand, if you kind of catch my drift. It's a good preventative, and we recommend feeding it daily for 7 consecutive days. I hear people that say, oh, my horse gets it every Tuesday or Saturday, or my horse only gets it for 2 days. In my experience, it takes about 2 to 4 days for it to accumulate and actually to start to work. So I tell people, yeah, if you're only feeding it every 3 days or so, that's great, but you're probably wasting your money. So if you can, try to feed it in a consecutive system. Some people, they only feed it like every few days because it can cause colic. What it does once it's in the digestive tract, and you can try this at home too, is throw a few pellets in some water and it'll turn the water almost, not into a really hard jelly, but almost into a soft jelly. And that jelly helps trap the sand and get it out. You're not going to be looking for Jello filled with sand in your horse's poop, but that's basically what it does. Does that answer your question about psyllium?
Yes.
Yep. Okay. So right dorsal displacement. Again, look in here.
Dr. Boeche,
Yes, sir.
These sand colics, They did a study on horses. They actually x-rayed their abdomens to make sure they didn't have any sand. It's a controlled study. And then they weighed out, I can't recall the amount, 5, 10 pounds of sand, gravel, two in a funnel. Every horse got the same amount of sand. Then they could divvy them up into 3 groups. One group they didn't treat with anything, didn't change their diet or anything. The second group they put on psyllium. The third group they didn't put on psyllium, but they gave them all the excess grass hay, not alfalfa, but grass hay that they would eat. They had to clean up for 2 or more. They put a diaper apparatus on them for the next 5 to 10 days and collected every drop of manure out of them, washed it, reweighed the dirt. The horses on excess grass hay moved more dirt through them than the psyllium horses. The psyllium horses moved more dirt through them than the horses that didn't give anything. So what they advocated is if you had a sand colic, that you were treating psyllium and excess grass hay.
And to build on that too, not every horse that eats sand or lives in Las Vegas is going to get sand colic. The other thing I try to use to explain to people is, for example, some people can eat Mexican food, some people can't. It just upsets their digestive tract, and it really depends on the individual how much they actually eat and how much it actually irritates their digestive tract.
So is what Dr. Lamb is saying, is he saying perhaps maybe buy a bale of grass hay and feed it to them occasionally so that it passes
the point I think he's trying to get at is your grass hay is going to be your ultimate fiber source to help clear stuff out.
Okay.
Yeah. So right dorsal displacement, what this is an abnormal movement of the large colon. It's not quite a twisted gut. The best way I can do to explain how this moves is your large colon basically coils on top of itself like a snake does. Not completely, but that's the best way to explain it. It's not a twist where it's going like this. It's just going, wrapping around on top of itself. It's usually secondary, which means it's due to a different problem. It isn't the only thing that happened. So going back to impactions causing more severe colics, this is one way it can progress to a more severe colic. Same with enteroliths or stones, and that's going to be the next one we'll talk about. And motility disorders as well. So just like an inherent genetic type of thing where the digestive tract just doesn't move as well as it should or as normally as it should. Sometimes these can be treated medically. Sometimes they need to be treated surgically. How we determine which one we need to do is if they're responding pretty well to medical treatment and we do repeated rectal exams, we can feel the change. But if a horse is just very painful and uncomfortable, and one of our clients here can attest to that because that happened to her horse, what we have to do is go in there and physically take it out. So this here is some examples of colic surgery. This here is your large colon completely taken out of the horse and on a sterile table. And what we'll do with colic surgery is this bottom here, this is your pelvic flexure. We'll do what's an enterotomy, so cut into that and empty all the poop out before we put it back in the horse. And this person here is putting it back into the horse. Enteroliths, also known as stone colic, and we have a variety here because they can come in a variety of shapes of forms. They do form like pearls do in oysters, so if you can see here, kind of like a tree.
No more dinner for you.
Oh, no more kids.
You all right back there? Okay. So your stones, they form like pearls, do in oysters. So if you can see here, like how a tree gets cut in half, what we call concentric rings, it slowly builds over time. And usually they have to eat something called a nidus or something that starts it. So whether that be a piece of sand, a metal shard, twine, or we could even have a plastic baggie. Okay, so a whole lot of things can start that to form.
How much truth do you think there is to breed specific to more?
We'll get to that. Stay tuned. So the two places they usually get stuck at, is the small colon or the large colon. Your small colon rocks, I think this one I actually took out of a mini. We'll have a few of these stacked up next to each other. I'll go ahead and pass that around. And ones that usually get stuck in the large colon, this one I took out when I was an intern. Fortunately, the horse passed away, and this weighs about 14 pounds. Okay, I don't think I'll pass that around because I don't think you guys want to toss that around. Or sometimes people will see these little things that look like river pebbles. Sometimes your horse's manure will contain those as well. Surprise, surprise. So risk factors for enteroliths, definitely where you live. Unfortunately, we're in one of the hotbeds for stone formation. Another area would be in the southeast. Diet's higher in minerals, and magnesium seems to be one of the proponing minerals that causes stones to form. Your feeds that are going to be high in magnesium are going to be your alfalfa and your wheat bran. Also, water high in minerals, especially here because we have a high mineral content in our water. Breeds, going back to your question, studies have shown that Arabians, Morgans, saddlebreds, donkeys, and minis tend to be more predisposed to it. Can't necessarily give a reason why for it. Maybe they have a more acidic or digestive tract that causes it. Ages in horses tend to predispose one for colic as well, because in order to get this big, 14 pounds, it's going to take some time. But the youngest I have seen it since I've been here is in a 3-year-old that's from Las Vegas and was eating exclusively alfalfa. So how to prevent enteroliths? If you can, diets not including alfalfa or high levels of magnesium. Easier said than done, especially here, because alfalfa seems to be one of our more readily available, less expensive feeds. But if you can get away without feeding it, that would be ideal. Also with going back to wheat bran, because it has quite a bit of magnesium in it. Decreasing the colon pH, so making it more acidic, can actually help in some studies. So that's why you hear people feeding apple cider vinegar in the food, because that can make the colon a little more acidic and decrease the magnesium from forming.
Is it in the food or is it in the water?
Is what? What are your,
The ACV.
however you can feed it. People a lot of the times will feed it in a mash. Some horses like to drink it. Yes, ma'am.
What's your recommended dosage?
Start out with a 1/4 cup daily and work up to a cup daily.
Every day?
Mm-hmm.
Every day?
Mm-hmm.
I put it in my grain every day and I've done it for 20 years.
Just straight in your grain then?
A little splash for a cup of my grain every day.
That's better than water, but I don't have food, that's why
Last time I did, it was 2 cups a day.
Again, everybody's different.
And actually, good horses can put stones in the digestive tract, especially with them, and they would go retrieve them, pull them out, maybe weigh them while they were on this acid. You can't swing those up. And a live horse.
Yes, ma'am.
The treatment for minis, I'm sorry to go back a
Mhm.
little bit, with this psyllium, is it much different? The 7 days, does that work the same? I mean, I understand a lesser amount.
Yeah.
I don't know if it says it on the containers. Does it say it on like the Santa Clara?
It should give you a pounds per cup, how much you should feed it. Your average mini, depending on how rotund they are 200 to 400 pounds.
Okay.
Both brands, Colic and we sell where I work, on the label, it just says feed the 1 scoop.
The 1
1,000
scoop I
pound
got,
horse,
right?
And then it says feed less to minis.
Yeah.
That's all it says.
So if you're feeding a cup to a 1,000-pound horse, if it's a 250-pound horse, it's probably going to be a 1/4 cup, because that 250 pounds is a 1/4 of 100 pounds. So feeding psyllium fiber as well can help. That's mainly trying to get the sand out that can start it to form. It's not necessarily the sand itself that forms layer of stone. It's usually your minerals that are in your food and your water. So the psyllium is mainly to get the sand out so stuff doesn't start to form. Going on to strangulating lipoma. I don't know if any of you have had dogs here that have these little bumps on the side of their chest as they get older. Those are also fatty lipomas. Horses, for some reason, like to form them inside next to their digestive tract, making another obstacle for the digestive tract to avoid. They can be as small as a quarter or as big as a volleyball. If you want to go afterwards to the treatment room next door, we have one that's about as big as a volleyball. It hangs on a small string-like piece of tissue. Right here is where it would start at. And then the small intestine wraps around the lipoma. So the small intestine, of course, normally it's going to move because it has muscle in there, and that's how your food's going to get out of your digestive tract. Your small intestine in these cases can accidentally wrap itself around one of those lipomas. Thank you. And then the small intestines get wrapped around tighter and tighter. Again, going back to the image of the python around the neck, that's kind of what the small intestine does on itself. Food can't pass through the intestines, and then the blood supply to the intestines stop. Whenever you get blood supply that stops to any part of your body, you start to get toxic tissue. Oops. Start to get toxic tissue because the blood can't collect all the toxins that the body normally produces, and it can't get any fresh blood back to it. So if you have a queasy stomach, don't look at this next slide, okay? Sorry, I skipped ahead. So this is just, for example, what happens in the digestive tract with strangulating lipoma. This here on the right, this is nice, healthy, small intestine as far as the color. You want it to be a nice pale pink. But what happens is as it gets strangulated, it starts to turn into what we call a blackberry jam color. And this is intestine that's starting to die off. So you see the lipoma here in this person's hand, and then the stalk right here that it was wrapped against. And you can see that again right there. And going back to the belly tap, this is another reason why we do a belly tap or a peritoneal tap, because as this body part starts to die off, your belly fluid, which should normally be a nice bright yellow, will start to turn orange or pink or dark red. Because if this is starting to die off, it's starting to leak products. That's going to change the color of the fluid. Same goes for twisted guts.
Can that come back after you take that thing off? Can the intestines come back? Or is it
Intestines, this color, how we determine whether or not we need to leave the body part in there is if it moves once we untwist it, what the color looks like, how thick it is when we touch it, and based on that, for example, like this one here, if I were the surgeon, I would take that out because it's going to continue to die in the body and negate your reason for going to colic surgery. So what we do is we cut it off to where we get back to fresh pink edges and stitch it back together. Depending on the horse, sometimes we can do it, sometimes we can't. Because we can't always reach all of the small intestine because physically we just can't pull it out. So if we can't pull it out and get to the dead stuff, we usually recommend euthanizing them during surgery. I did have a horse last week that passed away from this. I put him down, and he had about 40 feet of small intestine that needed to be taken out, and that's quite a bit. In that case, we probably would have recommended putting him down because that's a lot in its small intestine to take out.
What causes?
You're strangulating lipoma.
I mean, how do they appear?
How do the lipomas appear, or how does the intestine get wrapped around there?
I mean, how can you avoid not getting those? Is there any possibility?
Stay tuned. So your predisposing factors, I love this when I saw that. That's cute. Again, usually in the teens because sometimes you need some time for that to form. And overweight horses are more prone to this because fatty lipomas are made out of fatty tissue. The horse that I had to put down last week for it, he was pretty obese. As soon as I cut into him, even right underneath his skin, he had quite a bit of fat I had to dissect through to get to it. So keeping your horses fit and trim. And again, like if you, especially I would say probably like 12 to 19 or so. That's usually the age of the horse I see strangulating lipomas in. So last but not least, the twisted gut. Large colon torsion or a volvulus. So going back to your strangulating lipoma, how it twisted on itself and nothing can pass through. That's what happens to your large colon as well. It can twist and nothing can pass through. Cuts off the blood supply to the colon just like it did in the strangulating lipoma. And remember, no blood supply equals toxic tissue. And this isn't necessarily the only kind of twisted gut that happens, but I just try to keep it simple for time's sake because we could get super technical. But this is probably one that we see a lot. It can be what we call 180 degrees, so it only turns 180 degrees, or it can be 360 degrees where it completely flips on itself. Just really depends on the entity of the disease. So your large colon volvulus torsion, these horses are extremely uncomfortable. These are the ones you see rolling around uncontrollably. I use the image of a fish out of water. They're flopping around like that, just uncontrollably. Up and down, breaking out into a sweat, just twitching, very uncomfortable. And because a horse is rolling does not necessarily mean that it's going to twist its gut. It can happen sometimes, but not necessarily all the time. When we get to horses that are already rolling, usually the gut's already twisted by then, okay? It can be due to primary, so these things can happen just inadvertently, just decide to twist for no inciting reason, or it can be secondary, so like an impaction colic that's getting worse. So again, going to surgery, this is the same horse. So this is what the colon looked like before it got untwisted. So again, it's pretty dark and purple and what we call congested. Your blood vessels, see this white line here? Your blood vessels branch off this white line and again right here. So what happened is they untwisted the colon, see what happens, and then after a few minutes it starts to get blood flow again and starts to look happy and pink, okay? Sometimes we do have to take out a cecum or a large colon. Those have a very grave or poor prognosis just because that's a lot of digestive tract important parts that we need to take out to help the horse, but sometimes people want us to do it. So any questions about that? Okay. So next is going to be my plug for people who give injectable Banamine in the muscle. I'm going to use this time to give you a reason why not to, because that can happen. This is something called Clostridial myositis, which is a flesh-eating disease. And for some reason, you can give Banamine in the muscle to cows, sheep, goats, but for some reason, it just does not mix well with horses. It doesn't. Yeah. This can also happen with other injections as well, so even like with the simple vaccine, because this bacteria normally lives on the skin and you just accidentally get it in there, but for some reason, Banamine and given in the muscle in horses, this can happen, okay? I've had people where they give it and they don't have a problem, but just a plug, that's why I wouldn't do it. Your well-trained veterinarian should not be giving Banamine in the muscle. Yeah, in the vein. Yeah. When you see them give it in the neck, it's usually down here, right here. So they're usually giving it in the vein there. And what I do when I stick my needle in there is I always pull back with my syringe a little bit to make sure I get what's called a flash. So a little bit of blood in my syringe. And just because I've done it a few times, I'm pretty comfortable that I'm in the vein versus the artery. That's the second thing you need to be worried about, and I just go ahead and give it. So, review. Yay! We're there at the end. There's a lot of causes of colic, okay? And when you give us a call, and I understand you're going to be panicking, my horse is colicky. Well, what does that mean? Just give us a few extra tidbits. Are they pawing, not really eating, laying down a lot, that type of thing. That really helps us give us a better picture of what's going on and what we need to do by the time we get there. Number 3, mild signs can quickly progress to severe signs. So if you see a mild colic, you can definitely wait and see what happens, but I wouldn't recommend it because a lot of times we see those when they're first starting, we nip them in the bud and we don't hear from you again, unless if it's for a nice update in the morning. Take the temperature, heart rate, respiratory rate, and listen to gut sounds if possible before you call us. And remember, when you're listening to heart sounds, lub-dub, lub-dub. So make sure you count that as each heartbeat.
What was the respiratory rate again?
Respiratory rates of, in the teens. Over 20 is going to be stressed. And thorough, consistent horse care is going to be the key to help prevent colic. And please call us before you give any medication. Yes, ma'am.
Listen to gut sounds, you just want movement gut sounds, right? You don't
We want movement. If you can kind of tell if it sounds kind of gassy or not. If it sounds gassy, it's going to sound like a basketball against a basketball court, okay? And also, do you hear a lot of gurgling? Because sometimes that means diarrhea. Do you hear just a little bit of gut sounds, which means it's slowing down? Or are the gut sounds not there at all? I usually listen for about 15 to 30 seconds to see if I hear any gut sounds. And if I don't hear any gut sounds in that time period, then I quantitate that as absence of gut sounds. Mm-hmm. Yes, ma'am.
You had up here, and you mentioned it, is it okay if I mention about the glass horse?
Yeah.
The Glass Horse DVD series is an interactive DVD, and it goes through all the different kinds of colics, and it shows you the horse in like 3D. Takes it apart in pieces. It's very cool. It's called the Glass Horse. I don't know who creates it, but
Yeah, it's a really cool DVD. We use that here too to kind of help show clients what's going on as well. And some of the pictures I used came from that. It's really good. Yes, ma'am.
On the stones, if you catch it early enough, can you get rid of it without surgery?
If a horse is actively colicky for it, we usually recommend surgery to get it out because it's gonna get taken care of quicker if we get it out. Yeah. Yes, ma'am.
I travel a lot, so what would be the best, I guess, on the road in the middle of nowhere? How do you even find a minute when you're going cross country, and what should you have on hand, and what should you do when
You can
you're
go
at a rest
to
stop in the middle of nowhere and
you
your
can
horse goes down in the trailer?
you can go to aaep.org, and they have a really nice app where you can locate a veterinarian, and it is within a GPS, and you have X stable as well as an app, EQ, and then stable like a horse stable to locate a veterinarian. Have a tube of Banamine on hand if you're not comfortable giving Banamine vein shots, okay? And then if you have a pretty severe colic and you have a good relationship with your veterinarian, sometimes we will give you sedation to have on hand if it's pretty bad and you need to get somewhere without your horse injuring itself. AAEP.org and X stable, EQ, and then stable. Yeah. Yeah.
Is there anything that should not be injected IV? Because you were saying anything really injected IM can cause that infection because of the skin. Just to play it safe, because you do everything IV?
So the only thing we, there are some antibiotics or medications we cannot give in the vein because of the stuff that's in the antibiotic to help it work can cause a horse to have basically an anaphylactic shock. One in particular is penicillin. It comes in two forms. We have a form that we can inject in the vein, and then there's a form that you have to inject in the muscle, and that muscle shot is usually white, and you don't. Vaccines, those need to be given in the muscle because they have something called what are called adjuvants, and those are the little machines that help make the virus spread better and have the horse have a better response to it, and those can cause anaphylactic shock as well. Yes, ma'am.
You might have touched on this at the very beginning of the second part. Signs of dehydration, like you know how sometimes you can see symptoms like through the eyes. Is there anything that you recommend that would kind of stimulate?
Eyes in horses, because in cows, that's a really good way to monitor dehydration. Horses, not so much in my experience. Skin turgor, so pinching the skin, you make sure you pinch it in front of the shoulder on the neck to get the best accurate reading. It should go back within 2 seconds or so. That's again what we call a subjective reading, so it could be a false reading if it's staying tinted. But obviously if you pinch and it stays tinted up and it's not going down, your horse is dehydrated. Another way that you can monitor dehydration and that we use a lot on our physical exam is how the mucous membranes or the gums feel. Do they feel dry? Do they feel tacky? Or do they feel moist? Dry to tacky usually means dehydration. Moist, so if you feel your own gums right now, that's what their gums should feel like.
And on a separate note, what about frequent urination? Is that any
That-
related to?
That can help, so just seeing if your horse's urine is a little more concentrated than normal, so a little more yellow. White color to it at the end can be normal because horses have a lot of what's called calcium in their urine. Absolutely, yeah.
Back to the horses that crib, where they bring in a lot of air into their stomach and stuff, and a lot of times it's not really a colicky thing, it's just more like a gas bubble, where he can poo, he can do all that stuff, but he just still has all the symptoms that you mentioned.
So it's still colic.
So it's still colic.
Because again, colic is a general term to describe discomfort in the abdomen.
Okay.
Any other questions? Spam.
You have a horse that's constantly sipping to the ground and dirt, eating, you see their lips. Would you recommend anything? Because obviously they're going to be ingesting more sand.
Right. That's one I recommend to people to have mostly wood or compost bedding when they're turned out. If their head goes straight to the ground, bring them back inside.
Not necessarily when they're colicking, but just
Right.
when they're, okay.
Right. And then another way you can do it too is people that have obese horses and have them on pasture, they'll put grazing muzzles on them so they don't eat as fast. You can do that too when your horse is turned out so they don't get into the sand, but whether or not it works, I mean, it can help, but.
It's just keeping the sand clear on them
And changing their environment.
that. Okay,
Yeah.
I didn't know certain mineral blocks or certain
Right.
something else.
Well, I want to thank AEP because I stole part of their presentation for this. That's a great website too for you, our clients to go to for a resource. They have articles on anything from strangles to hock injections, you name it. They're going to have it on there. So if you want a good information source on the internet, I would stop here first, okay? So any other questions, you can come up to me. Yeah, one more.
This is probably an oversimplification, but it seems like there are two types of horses. Horses that have had colic and horses that haven't had colic yet. But when you have a horse like the one you're treating right now,
That's a whole nother ballgame.
Exactly. She seems to colic when the stock market drops. I mean, if you change the hay, she colics. If it gets hot or cold, she colics. She colics constantly. What are some of the things that can be checked, or how do you go about checking to see what might be causing something with this sensitivity? She's really bad.
Yeah, that's when keeping a diary of your horse's daily activities really helps out. We also look to see if there's any other causes, whether it be liver, going back to liver or kidney problems. If there's a motility disorder in the digestive tract, we can send off biopsies for a specialist to look at that. We can run blood work, we can do ultrasound. There's a lot we can do. It's just with Missy, she's one of those unique girls. She is. I cringed when Linda called me yesterday, so. All right, guys, well, thanks for sticking out. This one was a little longer.